Welcome back as we start our second portion of our full body terminology. All right, now we're going to talk about the abdominal quadrants. Remember, quad means 4. So our landmark for this is our umbilicus, which is our navel. Our quadrants are going to follow as below. You will, most of the time when you're talking about quadrants, you're going to be using the abbreviation for it rather than the full word. But RUQ would stand for right upper quadrant, LUQ left upper quadrant, RLQ for right lower quadrant, and LLQ for left lower quadrant. These are also going to be used to determine where our McBurney's point is and our Monroe's point. I'm going to give you a little tip for remembering which is on which side. Our McBurney's is going to be on the right side and our Monroe's is on the left. I think of it as in, even though Marilyn Monroe's last name is spelled differently, she left the earth too soon, which is why I say the Monroe's on the left. And then McBurney's, I don't know if anyone's ever had Bernie's that we have here in Smithfield and in Clinton, is really, really good, right? You can't go wrong with bringing Bernie's, so I think Bernie's is on the right. You can't go wrong. You can only go right. Anyway, silly terms, but anytime that you can create some kind of word association or some kind of association between learning new terms helps you learn it so much quicker. All right, so here's an example of what our abdominal quadrants look like. So you have your umbilicus in the middle. The way you find your McBurney's point is imagine your iliac crest from your bone, also known as your hip bone, that part that protrudes in the front. All right, imagine that being there, and you draw a line from the edge of that bone up to the umbilicus. All right, and 2/3 down is where your point's going to be. So right here on the patient's right side, we have the McBurney's. Now at the same point, on the other side, that's our Monroe's. So you can imagine if someone comes in complaining about pain in their McBurney's point, what's right there around it? Do you see that little thing hanging down? That's your appendix. So that they may have appendicitis, but until they run tests or they view it, they're not going to know. So on their admission to the ER, for instance, it would say that they have pain at the McBurney's point because we haven't really had a moment to diagnose anything. Does that make sense for you? So you want to, that's why it's important to know these terms and where they are. All right, question. When you look at the diagram of the 9 body regions, what number would be the right lumbar region? Remember, they start at the top. So our lumbar we know is in the middle, right? And then we're talking about their right and left. So it would probably be number what? 4. So your answer, yes, is C, 4. Remember, you're looking at a mirror image, direction of the opposite of what you see on the page. Okay, so true or false, the McBurney's point is a landmark for the 4 abdominal quadrants. Even though we do use the McBurney's point, we're using the umbilicus. That's our center of the outer 4. Remember, that's all where they convene is at the umbilicus. So our umbilicus is going to be our landmark. All right, now we're going to talk about body cavities. We have 2 main ones. We have the ventral, which is in the front half, and then we have the dorsal, which is the back. Kind of think of like a shark or a dolphin. They have those dorsal fins, right, on their back. So remember that dorsal always means your back. Within those cavities, though, our ventral cavity, we have our thoracic, our abdominal, and our pelvic. Sometimes you'll hear the abdominopelvic region. That just puts them together because technically they're not separated by anything. And then in our dorsal, we essentially have our central nervous system. So that includes our cranial and our spine. Body cavities, again, here is an example of it. So you can kind of see in the peach coloring, we have our cranial cavity, and then our spinal cord goes all the way down. That makes up our dorsal cavity. Then we have our front ventral cavity, which is our our thoracic cavity. I did want to mention that it separate that and the abdominal are separated by the diaphragm. That's why those are 2 separate ones, and why sometimes you'll hear just thoracic and abdominopelvic. But within the abdominal cavity, we do have the abdomen, and then we have the pelvic region. All right, so true or false, a body region located in front of the spine is considered to be within the ventral cavity. That is true. Only the brain and spine are in the dorsal cavity. All right. The blank cavity is separated from the blank cavity by the diaphragm. We just talked about that. So I'll give you a moment. If you said B, you're correct. The thoracic and abdominal cavities are separated by the diaphragm, which is the muscle that aids in the respiratory process. All right. So now we have the divisions of the back. We have our cervical vertebrae, our thoracic vertebrae, and then our lumbar vertebrae, followed by our sacrum and our coccyx. You can see each section, how we have C1 through C7, T1 through T12, and L1 through L5. You do want to know how many vertebrae are in each section, but I'm going to teach you a little trick that'll help you with that. First, here's our visual. So we're our cervical vertebrae, which is in our neck, followed by our thoracic. Remember, thoraco means chest, and then lumbar, it's our lower back, followed by the sacrum, and then our coccyx, which is our tailbone. All right, true or false, as long as you know where the divisions are in the spine, you can count from either the top or the bottom to correctly identify each vertebrae. It is true. For instance, T12 could be found by counting from the cervical vertebrae, but it's much closer to start at the lumbar at L5. So if we go back, see here's L5, right? So there's 1, 2, 3, 4, 5. We know the next one is the last of the lumbar, of our thoracic vertebrae. So we know that that would be T12. All right. So you can always remember the vertebrae easily if you think of the ideal meal times. So for breakfast at 7, lunch is at 12, and dinner is at 5. So that's how I remember breakfast, lunch, and dinner. This was something else that some students had helped with their memorization of it. Cervical, usually cereal, so that one's close to that, cereal for breakfast. Thoracic, we didn't really have one, but if you remember cervical and lumbar, you'll have it. Someone said lumbar, I slumber in bed after dinner. So maybe those will help you remember breakfast, lunch, and dinner and which ones are which. All right, so directional terms, we're going to show two opposing. So we have superficial versus deep. Remember, superficial is going to be on the surface, and then if something or a protrusion goes inward deeply, then that would be deep. Anterior versus posterior. Remember, we're starting at the front for anterior, moving back. Posterior, we're starting in the back, moving forward. Then we have ventral and dorsal. So our ventral is our frontal section, and our dorsal is the back cavity. And then we have superior versus inferior. So anything above the transverse plane is superior. Anything below that is inferior. Cranial and caudal. So cranial would be moving up towards the head, and caudal would be moving down towards our tailbone. All right, so this is another example. So for moving ventral, we'll be moving towards, remember with ventral, you're starting in the center. All right, we're starting in the midline of the body, in the middle. So ventral means we're moving towards the front, and dorsal means we're moving towards the back, if you're using it in a directional term versus the cavity. And then same thing with cranial caudal. We start at the transverse. If we're moving up, it's cranial, moving down, caudal. Remember, from the top going down is our coronal plane. All right, now we have directional terms with medial versus lateral. Remember, medial, we start at that mid-sagittal, and we're medial means we're moving towards the midline, lateral moving towards the side. Then we have distal and proximal. I'm going to talk about that in a second. That has to do with the point of attachment in your arc extremities in relation to that. We have supine and prone. Supine is when you're laying flat on your back, looking up. Prone is when you're laying on your stomach, looking down. Supination versus pronation. So supination would be face up, moving upwards. Pronation, face down, moving down. So keep in mind the difference between supine and supination. The Asian part is your clue to remember that it's motion, it's movement, okay? So supine and prone is a still position. Supination, pronation, we're moving, okay? Plantar versus dorsal, this will be having to do with your foot. Now your plantar is going to be the bottom of your foot. Dorsal is the top. to kind of help you remember that, where's the back of your hand? Okay, plantar, and then this for our palm is palmar, which again we'll get to. All right, we're going to continue and hopefully wrap this up with our directional terms. So remember, moving towards the midline is what? Medial. Moving towards the side is lateral. The nearest point of attachment, that's going to be proximal. Think of if something's approximately close to you, or it's, you know, you're in approximation, it's close. Distal, think of distance. That's the farthest point of attachment. All right, and then we have our midline, right and left. We're good with that. Common nouns can help in keeping directional terms straight. For instance, if something is in close proximity, it is, and if something is in the distance, it is, right, proximal and distal, so D. All right, that wraps this up. I have a sheet that I'm going to go ahead and post for you to work on. It's going to be like a presentation. You will have the first sheet. I advise you to use your first sheet first. Try to fill in the blanks, and then use your second one to just verify that you had the correct answer. All right, if you have any questions, please feel free to email me right here, and I'm happy to answer any questions. Thanks.